name's Cheryl and I'm here to demonstrate how to give an IM injection. Like with all procedures, before you see a patient, you must use a hand rub or wash your hands before entering patient's room. So I've received handover on all my patients and I'm just going to see how they're going. Knock, knock. Hi Sophie, how are you feeling?
Oh, I'm just still feeling a bit nauseated. I feel like I'm going to vomit.
Oh, that's not very good. So I'm just going to quickly check your medication order to see if you ordered some Maxilon or Sustabital.
Okay.
So, okay, so we've got Sophie Spring, date, metoclopramide, IM, 10 milligrams TDS. Okay, you have been written for some metoclopramide, which is otherwise known as Maxilon. Have you had it before?
Maybe years ago, but not recently.
So you haven't had any medication today?
No, I haven't.
Before I run off and check and get some, can you tell me your name, please?
It's Sophie. Sophie Springer.
Sophie Springer.
Mm-hmm.
Sophie Springer. And your date of birth, Sophie?
It's the 17th of January in 1954.
17th of January 1954. 17th of January 1954. And your medical record number is 02003001. 02003001. Sophie, are you allergic to anything?
Not that I know of.
Not that you know of. Okay. What I'll do is I'll just quickly race off to see and get some medication. I'll be back with you very shortly. So here's the buzzer.
Okay, nurse. Thank you.
Thank you. Susan, can you come and help me check some medication, please?
Sure.
I've got Mrs. Springer, and I've checked that she's the right patient. She's feeling a bit nauseated, so we're just wondering if I can get her some Maxilon.
Okay.
So I'm just going to validate the order. So I've got an MRN, a patient's name and date of birth, and she's not allergic to anything. I've got today's date is the 5th of the 7th, so it's within 7 days. And it's metoclopramide, otherwise known as Maxilon IM, 10 milligrams TDS for nausea, signed and printed by the doctor, and it hasn't been given, and she states she hasn't had any medication. So just check the MIMS and make sure the doctor's ordered the right amount. Metoclopramide. Metoclopramide for injection, 337. Okay, metoclopramide for injection. Dose, IM, adults over 20, 10 milligrams 3 times a day, and they're written 10 milligrams TDS, which is 3 times a day. And there's 3 time slots here written, and it hasn't been given. Are you happy with that?
Yep, I'm happy with that.
I'll just quickly check the side effects just so I can tell the patient. Okay. I'll just let that open. So I'm just going to do my first medication check. Okay, so we have metoclopramide hydrochloride, metoclopramide, 10 milligrams TDS, hasn't been given, signed and printed by the doctor. It's written within the last 7 days, and it's IM. It's 10 milligrams, and expires 31st of the 12th, 2015, and we've got Sophie Springer and no allergies. It's my first medication check. I'm just going to gather the best of my equipment. A drawing out needle, a 3 ml syringe, and an alcohol wipe. So, let's do my drug calculation. So, strength required over strength and stock times volume over 1. The strength required is what the doctor's ordered, which is 10 milligrams. And the strength in stock is what's on the vial, so that's 10 milligrams. And the volume of the vial is 2 mils. So 10 over 10 is 1. So I've got 2 times 1 is 2 mils. And as I said, INI. Are you happy with that calculation? Yep. Okay, so I'm just going to draw up the medication first. Put up my drawing on needle. I'm going to do my second medication check. So I have a patient's name, MRN and date of birth, some known allergies which she confirmed, and then I've got today's date which is written within the last 7 days, so it's valid, and metoclopramide, IM, which is an iron injection, 10 milligrams per 2 mils. We calculated that to be correct as 2 mils that the patients require, and I have 2 mils in there.
Yep.
Are you happy with the 2 mils? And the expiry date of the medication is within the day. Is that correct?
That's correct.
And it's being signed and printed by the doctor and the patient hasn't had it. Are you happy with that? So that's my second medication check. So can we go to the patient now?
Yep, sure.
Yeah. Hi Sophie, how are you going there?
Very nice.
I've just got the medication for you, and I'm just going to, I've brought a colleague to check that I have the right patient and the right drug. So is that okay?
That's
Hi,
good.
Sophie.
Hello.
So can you tell us your name, please?
Sophie Springer.
And we've got Sophie Springer.
Sorry.
Sophie Springer.
Mm-hmm.
Sophie Springer. And your date of birth, Sophie?
It's the 17th of January 1954.
17th of January 1954. 17th of January 1954. And her MRN is 02000301. 02000301. Sophie, can you tell me if you're allergic to anything at all?
No, I don't think so.
And
No
she's got no
allergies.
allergy bands on, and there's no allergies documented
Yep.
in the progress notes. Have you had any medications today?
No, none at all.
Have you had this medication before?
Long time ago, but not recently.
Okay, and there was no side effects?
No, no,
Okay,
I
good.
remember.
So I'm just going to do the last medication check. So we've just checked that we've got the right patient and there's no known allergies. So we now have today's date, it's written within 7 days, so it's valid. We've got metoclopramide hydrochloride, metoclopramide. It's an IM injection, 10 milligrams per 2 mils. On my drug calculation, we calculated that we actually needed the whole 2 mils. I've got 2 mils there. Are you happy with that? It's been signed and printed by the doctor and it's indicated for nausea, which she is, and expiry date is in the date.
Yep.
Is that
Good.
okay?
Yep.
And it hasn't been given. So now I will pop my gloves on and ensure the patient's privacy and pull the curtains and maintain patient's dignity.
For the purpose of an intramuscular injection, we're actually going to demonstrate using a mannequin. There are several different locations that you can inject intramuscularly. They include the deltoid, the vastus lateralis, and the ventrogluteal. In this demonstration, we'll be using the vastus lateralis. For further information on these injection sites, please refer to the recommended text. When injecting a patient, you need to promote privacy and patient dignity. Now we need to locate the actual injection site. Now, as I stated prior, we're actually using the vastus lateralis. So the easiest way is to place a hip just above the lateral aspect of the knee and the lateral aspect of the hip, and we're looking at that third of the mid-thigh, this area here. With any intramuscular injection, you need to cleanse the site. So we're using an alcohol wipe and we clean in a circular motion. And we leave the alcohol wipe on the skin to indicate where we have cleaned. We now take off the cap from the needle. There are 2 methods that you can use to inject. You can press the skin down and nice and taut, or you can pinch the skin, but in both situations the needle is at 90 degrees to the patient. So in this case we will pinch, inject the needle. So Sophie, wiggle your toes for me. Inject the needle, let go. Now we will actually aspirate for an air bubble. Once the air comes through and there is no blood, you may inject the fluid. Now, with the injection sites, each injection site has its own amount of fluid that it can actually take. So the deltoid is 2 mils, the ventrogluteal is 3 mils, and the vastus lateralis is 4. Now on moving the needle, apply a light pressure and move the needle cleanly. Assess for any bleeding, which there isn't any, and then dispose of your needle in a kidney dish and directly into the sharps container. This will close on its own. Remove your gloves and wash your hands. Then document in the medication chart and progress notes what you have done.